structural imaging are being used all over the world, basically MRIs, to tell us more about how the structure of the brain works and how the atrophy patterns or the shrinkage of the brain patterns can help in the diagnosis. However, functional imaging, such as PET scan, has been definitely up and coming and already used in many countries technique that allows us, using glucose, which is basically the food of our brain, using a ligand that is marking the activity of the glucose, is telling if there are some areas of the brain that are not using enough glucose. This is basically an indirect measure of the brain activity. And the pattern of the way it looks is quite specific for diseases. PET scan is being used, adopted, and overly used in Alzheimer's disease, in dementias of all type, and clearly has a sense to be used also in PSP and CBS, because they are still part of tauopathies, that part of them are indeed dementing illness. So what we see in PET scan, in FDG PET scan, is the presence of specific pattern in the brainstem, in the basal ganglia, in the medial cortex that is specific for PSP. However, there are other techniques, other PET scan, that are using specific ligand, specific proteins that are attached to tau, for example, the main protein of this condition, or to portion of the receptors of tau. And the problem is that they are not totally yet ready for the prime time, because there's a lot of heterogeneity in these conditions, as such that some of these PET scans are working well for one disease, maybe not for the other. And sometimes even within the same disease, if there's different level of pathology, this different mixed pathology, they may not work as well. So I think it's something that will be up and coming, but not necessarily right away. It will take more time to study that.